Hello, everybody. Welcome to yet another episode of scanO Cafe. Today, we are delighted to have Dr. Satish from Kaizen Dental. Welcome, Dr. Satish.
Thank you, Dr. Vidhi. The honor is mine.
Let's start from the beginning. How was your journey of pursuing dentistry as a career? Tell us that story.
Uh, okay, now majority people take dentistry as a second choice because they didn't get into MBBS. But in my case, it was absolutely different. I had the option of getting into MBBS also. So it was my dad over a dinner dining table. I've not done my schooling in India. I've done my schooling abroad in Dubai, basically. So he was telling me, why don't you go into MBBS? And I was a very happy-go-lucky kind of a student at that point of time. And I was like, "Ki MBBS mein, there's a lot to study."
Correct.
And I was quite dumb. So I thought dentistry has only teeth. Basically, how much you would need to study. Okay. So I told my dad at that point of time that I cannot do MBBS because they are like, you have to do your MBBS and you have to do your MD or MS or something of that sort. So I was not keen on studying 10, 12 years. So then my dad came back with a proposal of doing dentistry. And I was like, this is something which seems doable. How much you will have to actually study. So that's when I decided to get into dentistry. So I was not this career oriented. So I tell everyone, look at your career, look at things and everything. I was just lucky to be there at that point of time, and I told yes to dentistry. It was nothing, no logical thinking behind it.
That's interesting. Really appreciate you being so candid and honest about your journey. So, you mentioned you spent your childhood in Dubai. Is that right?
Yes, absolutely.
Both your schooling and junior college?
Yeah. So there you have till 12th, it's schooling.
Correct.
So it's not like separate things. So I didn't till 12th I did my schooling out there. And at that point of time, you didn't have good colleges for graduation. So if you wanted to get into dentistry or engineering or such, there were no very great colleges. Now there is. So it was always thought that you will come back to India and do your further studies. So that's how I came back here.
Correct. Even till today, right? We have great schools in UAE, but they are trying to pace up with the university levels, and
Absolutely.
both in terms of doctors and engineers.
Yes.
So, tell me one thing, doctor. Since you spent your say nursery to 12th in Dubai, and then came back to India for your BDS and MDS, versus your colleagues who had done in their schooling in India, did you see some differences in the thoughts, the way they approach life, again the way approach dentistry and patients? And would you like to mention some of those differences? Reason I'm asking this is because I've seen when you grow up among different nationalities, right, and different cultures, the way you think changes big time compared to just technical stuff or just one nationality. So would like to understand that differences if you saw any.
Oh, this is a very interesting question. No one has ever asked it. Uh, yes, there's a lot of things you see different. So first, when I came to India, it was a culture shock. Okay, because there you're used to so many people, not just from a given community, but from different nationalities bonding together. India at that point of time was very competitive. Okay, reason is we have such a huge population and limited resources, at least at that point of time. So people who get into dentistry or MBBS, it's like each mark matters. It's like they've come from a lot of struggles and got into dentistry. So that I feel personally hampers your long-term thinking. You are not able to have a very wide vision of life because you come from a scarcity mindset. Okay. Whereas when you have seen people at different grades and different levels perform, and then you come and you do this, you realize that this is not where it ends. The entire world is your platform where you can play with. So I think maybe that is something which was there at that point of time, but you can see that shift. Because if you see the younger dentists, they are coming from families where there are sufficient resources. The younger dentists are not facing those problems. So that scarcity mindset, maybe a generation of dentists 15 years ago, 20 years ago had, is not seen in the younger dentists. Let's take, for example, the timings. At that point of time, dentists used to work like 7 days a week, 12 hours, 10 hours. Okay. Dentistry was their whole and soul because they felt the more they work, the more they earn. If you see the younger dentists, even the fresh graduates, they're already talking about work-life balance. Okay. Maybe they've taken the conversation to the other extreme. They do not want to work, just life balance. But at least that discussion is there that we should work 5 days a week, 6 days a week, which is happening abroad. Other thing like asking for charges. The senior dentists were always thinking if we raise our prices, we will lose patients. That scarcity mindset was there. Whereas the younger dentists or the younger generation who have not been born up with that, they know that people are willing to spend. People are spending a lakh on iPhone. Then why not spend 10,000 on a tooth which will last 10 years, 15 years, at least 2, 3 times larger? So this mentality was there at that time. But right now with the younger generation of dentists, I am not finding that.
Right. That's a very valid point. What you mentioned is scarcity mindset, and now we are seeing a shift from that to not associating everything with, say, the cost. Because
Absolutely.
when you come from a background where every damn thing was in scarcity, and now you come from privileged backgrounds, or at least uh, when you've seen different things, it changes the way you deal with life and eventually patients.
Absolutely.
Right.
Because your consultation power increases.
Correct.
See, the patients can smell fear. So if you are scared when you're telling the cost, if you're scared whether this patient will get convinced, there's this fear mindset. But if you are more comfortable in your skin, you know that if this patient does not agree, I will get another patient. I know my skill sets are good. I know I can deliver on what I'm promising the patient. That itself changes how you consult patients, how patients treat you, how your practice runs. So I think that makes a lot of difference.
Right. You also mentioned a point about short term and long term thinking, right? The mindsets which we are now looking at a shift in India. But are there any pain points which you would like to mention, since you've been in practice since last how many years
15
now?
years.
15 years, right? And I know I'm jumping your story, but I really want to know in last 15 years the pain points that you see in younger doctors with respect to short term thinking. And it could be any, it could be learning new skills, it could be being very confident, not having that fear when they tell out a price or they tell out any treatment planning. And how can we change that?
Uh, Now we're talking about the younger dentists basically.
Yes.
So now they are not having those problems what the senior dentists have, but they are facing a different set of problems. Different set of problems means they feel patients should get convinced because they have been born in families where they got their way.
Hmm.
Okay, so they feel if I am asking a particular rate or I say a particular treatment should be done, if patients do not accept it, they take it personally. They feel that the patient is either accepting them or not rejecting them. They have to remove that personal attachment from it. Patients are not judging you personally, they are judging the value you can add. That's the first thing. Second thing is they want to earn, but you have to be willing to invest. Okay, the newer generation of dentists are comparing themselves with the seniors when it comes to investments. The seniors were lucky they didn't have to invest because the dentistry was at that point of time, at that point of frame. You didn't have RVG. Today when you start a practice, you cannot think of starting a practice without an RVG. So that initial 1 lakh you have to be willing to spend because patient sees that. Now, maybe 10 years ago, a dentist could put their practice, grow it, and then think about investing in a scanner. Now, once you put your practice, maybe within 3 years or 4 years, you have to reinvest the money you earn into a scanner. So, that mindset that when the patient pays, I take that money and I enjoy my lifestyle outside should not happen. That reinvestment cycle is not being seen in the younger dentists. So, they feel I have to have a high lifestyle, so what I should do is whatever money comes in, I should pull my money out first. They are not looking at the long term that reinvestment has to be done. So the more they reinvest, they can charge their patients better. So maybe they have to get into digital dentistry. Maybe they have to reinvest that money into learning new skills related to AI or something. That skill development so that patients pay you more is something which I feel is lacking at times with the younger dentists.
Correct. I completely relate and agree to that point. And I think we can make a change by first acting on ourselves, right? We
Absolutely.
should be practicing what we preach. And that brings me to the next question of what changes have you inculcated in your clinic within the 15 years of journey, and what all things have you reinvested? So if you can help us with your journey, I hope few candidates would take this learnings and inspiration and maybe try to inculcate that in their practices.
Okay, so this is one thing my wife always cribs. Her point is that whenever we earn money, majority of it we reinvest into our practice. So this has been the theme since the last 15 years. So we have spent less outside and we have spent less on ourselves. So majority of it has been reinvested till a point where the cash flow increased to increases to such a level where you can easily remove money. Okay. So when I started my practice, dentistry was completely different. Okay. We had regular IOPs. I used to do root canals at that point of time myself. There was no concept of paper points. I used to do rotary endodontics, though 90% of people used to not practice rotary endodontics at that point of time. So things like basic rotary, apex locators, rubber dams, RVGs. Now we have taken our first scanner around say 4-5 years ago, putting a scanner. So all these things require reinvestment. When I started, we had one shop. We had a 2-chair practice at that point of time. We bought another shop and we put another 2 chairs. So now it's a 4-chair practice. So all these things are initially heavy on the pocket where you have to spend a lot of money. So I have seen patients willing to spend more because they see whatever you have earned, you have reinvested. Okay.
Correct.
So these are like just the basics I've spoken about. We have bought a laser, we have bought a physio dispenser, we're trying to buy a piezo soon. So we have reinvested a lot of the money we have earned into our practice, which I feel is helped us grow. And when patients see the growth of a practice, they are willing to spend more in your practice.
Correct.
Now you go to a Starbucks, you're willing to spend more. If I go to a chai tapri below, I will be willing to spend less. What changes? We assume that the quality of a Starbucks coffee is better or a tea is better. I want to ask you one question. Could you actually go in the back end and see whether the person who was cleaning your cup at that point of time was following all systems? Was he a new guy who was cleaning it up or not? It is our perception of the quality.
Correct.
So you have to increase perception for your patients that your practice is growing. That's when they are willing to spend more at your practice.
Right. And also come back, be loyal, right? If
Absolutely.
you are investing in engaging with the patients and with empathy, not just on a superficial level, what I see multiple clinics doing it, they eventually will come back.
Yes.
And that gets me to the next question, doctor. Let's talk numbers. If you can give us a split of, say, if a clinic is earning X amount and put any amount, say, for example, maybe 3 lakh of revenue at the initial stages, how much amount of that should he be reinvesting so that, he can plan his financials otherwise? I know there is a fixed cost and a variable cost, and depending on the rent of the place, which
Absolutely.
varies.
The type of practice, how much they are charging,
practice,
whether
correct,
they have enough margins or not.
correct.
A lot of
But
things.
but in the world of finances, right, we have all these influencer talking about a split of, how much should you be saving, say 20% save, 30% reinvest, and 50% whatever. Do we have any kind of split or a formula that you figured out in last 15 years?
Okay, I'll tell you what.
Yeah.
If you see any of my content, I tell everyone there are 50 options available. You should select the one which is best for you. Okay. The reason is something which works for me will not work for you. Now imagine you're staying with your family. Your family is taking care of your rent because you're staying in their house. Okay, personal rent.
Correct.
Your family is taking care of your food. You have a family car, you don't have to buy your car. Majority of your festivals are celebrated in the house, so you do not have to spend in that. You have the leverage where you can spend say 80% back into your clinic. Okay. Now if I'm from a background where my parents have given me a particular sum, told me this is what I have for practice, now you take care of yourself and your life. At that point of time, I like it or not, I might want to reinvest 80% or 90%, but it is not always possible because I will have to live a life. I will have to take out the money to rent a place, clothe myself, eat food, everything.
Correct.
So putting a specific number, I don't think makes absolute sense. I think it should be for each one. They should have it at the back of the mind that majority of my money should be reinvested. Now, what the majority of your money is depends on person to person. I don't think a specific percentage could be put into it. At least I wouldn't be able to do that.
Right. No, it makes sense, right? How much split is going on to your personal expenses and what
Yes.
remains for your professional expenses, barring all the other costs which are already in the system,
Yes.
and then eventually reinvesting it. One question always, I think it's debatable in all the doctors, right? You mentioned that you earlier had one shop of 2 chair, you added one more, so you have a 4 chair. And during our offline conversation, I came to know that you're expanding still more. Congratulations on that. But doctor, do you think renting a space in the initial stages, right, makes sense? Or how investing, if you have that kind of a capital, upright purchasing it and then having it as your own store, that makes sense. What makes sense in the practice?
So I take this session for called Dental Clinic Launchpad. So anyone who's planning to start their own practice, okay? So it's like a one-day session where we discuss everything. So in that, I always tell that you should first decide what kind of practice you want to put. So there are different practice designs, okay? Not the class and the mass. That was old school work 30 years ago. Now you have different kind of practice designs. So depending upon your practice design, you have to select your area. So now if I decide that this particular area, this particular shop suits me, is where I should put my practice design, which I think will work over like 5 years, 10 years, 15 years, okay? And if I have the option to buy that property, then you buy it. What many people do is they have decided where they want to put their practice. They have a practice design, but they cannot afford that particular property. So what they end up doing is they buy a property somewhere else and they go and put their practice there. That does not work. So your clinic has to be based on what locality you think works for you. So now whether you can rent it or you have to buy it depends on your financial support.
Correct.
Okay. Majority of us in India do not self-fund it. It's not like in US or something where you're taking your own practice, you take a huge loan from the government or from the bank and you reinvest. You're not taking anything from your parents. Okay. You already have a DDS loan. It does not work here. Your majority of your investment when you're buying a property comes usually from the family background. So if you can buy that property, well and good. But do not shift the ideal clinic location to a location which you think will not work just because you want to own your property. So select your location and then decide buy or rent.
So this is interesting, and I think we won't be able to cover in the podcast, but there are so many things that a new person can learn during this dental launchpad.
Absolutely.
Right? Of whether you need to buy, rent, what are the areas according to your personality, what you can think, you can drive your practice into that particular areas, and there are a lot of dynamics as we know.
Yes.
Right? But coming back to reinvesting and putting in more, I think in today's generation, the era of digital, the era of AI, it's not just limited to the kind of equipments that you're reinvesting your
Absolutely.
finances into, but also new edge or cutting edge marketing systems.
Yes.
How do you think have things changed from last decade to today, and how should a doctor be marketing themselves, first themselves and then their practices, and what are the new ways of doing that?
Now, Vidhi, if you went to a new place, maybe you moved to Bangalore and you wanted to see a restaurant. If you had a friend in Bangalore 15 years ago, you would just call her, okay, and you would ask her, tell me a restaurant. She would suggest you would go and eat there. Today, if you go to Bangalore, you call her, she tells you, okay, there are these two options. Even though your friend has suggested you two options of restaurants, you will directly not go to the restaurant. You will still open your phone, you will still check the ratings on Google and Zomato, and then you will make your call. So now what has happened is, though we trust word of mouth, internet has become a second base where you go and recheck. Okay, the world has completely shifted. Okay, so the first thing is you have to have a good internet foundation or online foundation. Patients will not come directly to you based on your online marketing, but they will always recheck your branding online. So your online and your offline has to be on the same sync. This is the first thing. Now, you might have an amazing online brand. Now, when I come to your practice, whether I can see the same things out there. I remember 15 years ago when I put my practice in Airoli, we were the only clinic who was completely tiled. We had a wall tiles, floor tiles, everything. And we had wooden partitions at that point of time. Still, we were one of the most good looking clinics out there. Okay. But today that's not the situation. You go to each and every clinic, they look handpicked and well designed by interior designers. If you see those clinics, the way they are made, their ambience, everything at that point of time. Okay. So today when I walk into a place, how that practice looks, how that vibe is, how everything from when I enter is what I look into. So how the receptionist greets me. 10 years ago, 15 years ago, you didn't need to have a receptionist. You had your same assistant walking in and out.
Correct.
Okay. Today, when I enter, I expect a receptionist to greet me because of the services which people can get outside. The customers are spoiled by Zomato and Blinkit. They get things in 10 minutes. They're used to that level of customer service. So you have to upgrade it. So now, for example, your scanO, okay? If I walk into a practice and there are like 15 people waiting out there, I do not want to wait for those 15 minutes. How do I entertain myself? Now I can see it on the phone. If I'm on my phone, I will use Instagram and I will check other dentists nearby. I might check other uh, practices nearby. So you do not want that patient to be doodling other things in your practice. You want to grab their attention. So you would use your waiting area as a place where they feel comfortable. It's something like a coffee shop or something. So an app like a scanO, your robot which is there, they can sit there, they can see their teeth. So it gives them a different experience, a different feel. So that 10 minutes they are spending understanding your practice, they are spending understanding their mouth, and it gives that wow effect when they enter your practice, which might not be there somewhere else. So having things which others don't have, providing a wow effect is what takes you forward in today's day and age. It's not just word of mouth. So you have to work on your online branding, and when the patient comes to your clinic, you should be able to stand up to what you're selling them.
Correct. Absolutely. 100% valid, right? And no matter how much times or how in different ways we tell our faculty, we do have some doctors in the community which think that, okay, if I have to market myself, maybe the patients will think that I'm not good enough or my work is not great enough, which is why I have to market myself. I think today the biggest myth among the dental surgeons, because we don't learn these subjects in the curriculum, right? And I think they
Absolutely.
should be integrated, is the differences between sales, marketing, and advertisement. All of them have different roles, different call to action buttons, and eventually different benefits that a doctor would be getting for himself. So maybe if you mentioned about the idea of having courses for dental surgeons, later on if we can have something around these things of how different are these three verticals, and it help
Absolutely.
dentists, and it would not degrade their quality, or it would not show them as a desperate dentist who is marketing just because his practice is not running, but it's the need of the hour. I think we can match the power of other industries who are evolving at a crazy rate right now.
Yes.
Yeah.
And what I'm telling is not, it's not even marketing, it's branding. It's when I come to your practice now, Starbucks is not marketing to me. But I know if I want to have a good coffee, I might go into a Starbucks. It's basically they've created a brand. So the aim is to create a brand out here. So you are telling them you're the best without going and actually telling them I'm the best. So I'm telling you I'm amazing at this skill set without telling you I'm amazing.
Right.
So it is that you have to show it without telling it. So these are the things you need to work on. So in your online posting or your branding, you're not going to tell them that I'm the best dentist. You're going to say, see, this is my pre-op work, this is my post-op work. You tell me, is it great or not? This is what my patients says about us. You tell me whether it is great or not. So it's basically you're showing them without self obsession.
And I think again, it is non-negotiable where a dentist must have their GMB, they must have their website, they must have it upgraded. And then
Absolutely.
with all these cases, maybe a few papers if they've launched which are relevant for a consumer to read it, which will not just increase their credibility as a dentist, but eventually tick all the boxes which are required in this era, right? Coming to how can digital dentistry or AI can help us, not just for the initial diagnostics, but throughout the practices. What do you think are the top three elements with respect to AI in dentistry, which every dentist out there, whether an initial practitioner or somebody who's about to, retire from their practices, must inculcate?
I'll tell you what, I would not tell it as AI. I'll be honest. AI is just one more layer we are adding on technology. So currently, AI is a new technology.
Correct.
Okay. Basic technology starts with basic practice management softwares. So patient walks in. Do you have his entire history? Are you capturing data? Can you follow up with the patient? It's a fact 40% or 50% of practices still do not have a practice management software. So I'm sticking to everything what is technology, not just AI. So are you capturing data? Can you go back to your patients? Okay. It is funny to see that practices are not doing that still. Okay. Why many dentists say that why are we not having insurance in dentistry?
Hmm.
insurance companies are not willing to invest because they are not confident of your data.
Correct.
Okay. When they are confident that you're going to maintain that data, only then insurance companies can invest, which dentists are not having. Okay. So your basic practice management software. This is when the patient walks in. This is in the side from what the patient sees. Then comes the other part of technology which makes your life easy. So if you see in today's day and age, your life has to be made easy. In olden times, I used to take impressions, send it to a lab. It takes a day for the work to go. It takes for the day for the work to come. It takes another 2-3 hours for them to process it and everything. Today's day and age, you do the scan reaches the lab, they have to just print it. You get better quality and you get it faster. Okay, this is the second layer of technology to make your life easy. Third layer is when you add additional features on it, which is the upcoming technology, which is where your AI is. So AI would help you in various, it is my opinion in which direction it is moving, in treatment planning. Okay, so in treatment planning, as in there are things which you cannot see, the eye cannot see. You would be seeing 20 patients, 30 patients over a day. Each patient tells you has a pain, and you are used to only seeing that particular tooth and treating that particular tooth. We are doing tooth dentistry in India. We are not doing complete full mouth dentistry.
Sadly, yeah.
Yes. Now, if you have an AI which can capture these images and give you a brief that this patient has calculus, this patient requires scaling. Other than this particular tooth, this patient has 4 other teeth with decay. This patient has 5 other teeth with recession. So if you have a printout of an AI which comes and tells you all this is there. So when you are doing your initial consult, you do not want to sell all these things to the patient because the patient thinks that you are trying to make money out of them. You focus on your initial consult on that particular problem the patient has. But you add all these findings with it. Okay. And if you have AI which has photographs of these findings, you can easily fuse it with it. So the patient goes home. So maybe the patient came with severe pain. You did an emergency RCO. So now he is in a mindset where he's open to other things because his pain is gone. You have given him his entire file. In his file, you have mentioned about the root canal and the charges and the crown or the onlay or inlay which will be required. Then he shifts his pages. He sees photographic proof of various things in his mouth and various treatments he requires. Okay, this is when he comes for his second sitting. You can go into that. You can explain him, see, these were the other problems we saw. It is better you treat this so that other teeth do not end in this particular condition. So AI makes your life easy, would make your life easy as it becomes more advanced and has more people incorporate it when it comes to these things.
Correct.
Okay, so I feel there is one part, the patient part, one part, the dentist part, one part is convincing the patients for further treatments and making your treatment easy. So I think these are various layers. These are just the tip of the iceberg. There are various things which AI will help with. I feel orthodontic practices are going to be very easy. Okay, there are studies which are showing that in US, when they checked radiographic images, and AI was able to determine the occurrence of cancer which might happen 5 years later.
Correct.
With using AI models which a normal radiologist could not. Basically, what is radiology? You see 2 cases, 3 cases, and your mind tends to see, acha, this is what I need to notice. If AI can see 20,000 cases, a human can see 10,000 cases, of course an AI is going to have an advantage over it. Things which are repetitive, an AI will be an advantage. Similarly with aligner treatment planning. Now one orthodontist has to see 20 cases and plan each of those cases. Imagine AI does the groundwork. See, you will need an orthodontist to check this AI later. So the AI can check all these orthodontic cases and come up with say 10 different plans. Then the orthodontist has to only go through which plan suits it. So an orthodontist who would spend 1 hour for one case can use that 1 hour and do 10 cases now.
Correct.
Okay. So this is things which will keep on adding.
Right.
So what changes I've seen in 15 years, I think in the next 10 years, it's going to be totally different. And you have to decide you want to be a laggard where you are just following what people are doing, or you want to be at least at the forefront of it.
Right.
So that is a call which each and every dentist has to take.
I mean, just day before yesterday, I was talking to one more veteran, and we discussed the same stuff of when AI has been trained over millions of images and in some sectors billions of parameters.
Absolutely.
Across all the age groups, geographies, and multiple diseases, the way it can give multiple treatment options, as it mentioned, will of course be more diverse and inclusive.
Absolutely.
Rather than one dentist or one specialist having his limited experiences of 30 years with limited geography and cases, right?
Yes.
And yes, I mean, I agree. It is up to the dentist's choice if they want to be a pioneer, if they want to spearhead the changes, or they just want to be a follower and get on the bandwagon once it has become a commodity or once it has become everybody's cup of tea.
There'll be a day
Hmm.
where patients will expect it. It's a norm.
Correct.
Today, hygiene is a norm in India,
Correct.
which may not have been the case 30, 40 years ago.
Yes.
It's a fact.
Yes.
So when it becomes a norm, you will have to incorporate it. So you want to wait for it to become a norm, or you want to show your patients that you're at the forefront of technology so that patients are willing to spend with you.
Correct. Dr. Satish, one thing which keeps on nagging me, what I've seen is in our community of dental surgeons, there are hardly few who wants to be at the forefront. Although they might understand the importance of inculcating this kind of technology that's coming into the systems early on and the benefits of them early on rather than waiting, they still do not take action. And I mean, till date, do not have my comments on why is that. Do you think it's because of short-term thinking, because of our country? Is it because of the profession, or it's just the wave? What do you think? I mean, in other fields, I've seen the percentage of the early adopters are much more higher than in the field of dentistry. Early adopters are hardly, if I would like to give a figure, less than 3%. Whereas in other departments or sectors, we have at least a range between 10 to 12%. What do you think, in your opinion, is the reason for that?
Comfort. I think people get comfortable with what they have. If I am at the forefront of technology, I need to learn it. See, if Vidhi, you have bought something first and I buy it second, the risk is on you. First thing. Second is, if any goof up happens, I know I can call you. Okay, I know you will help me out. So that fear and that laziness, and I am doing decently well for myself. Why do I need to take that risk? I think it's a combination of these three things. But I am more optimistic about dentistry. So I feel it is changing. I feel the number of people who are willing to take risk initially was less. Now there are more people who want to apply newer technologies in their practices. That is increasing over a period of time. This is what I have seen when I personally interact with a lot of dentists. I've seen that shift happening, and it is positive.
Correct. Paradigm shift, of course, it's just happening. And since through your both offline and online interactions, right, you have a sense of all the doctors across the geography, is there a certain pattern or trend would you like to highlight that, say, doctors from this particular states are faster than in particular other states of the country, or is it related to, say, specialities, or there is no trend?
There is a trend. It is not related to specialities. It is not related to states. It is related to where they practice and the type of clientele they have. Now, if I am in a tier 1, we just assume all tier 1 dentists are similar, which is absolutely wrong. In tier 1, you have the poorer areas where they are maybe charging, say, 1,000 rupees for an extraction, and you have areas where they are charging 1 lakh for an implant. Okay, so that mentality of the dentist makes a lot of difference. Where patients are willing to spend, and the dentists know how to charge their patients well, okay, and they know their self-worth. They know if I inculcate a new technology, I would be able to charge my patients more. Okay, so it is more on localities and dentist mentality rather than on states, I feel.
Or cities.
Yes, because you will see people in tier 3 cities also who are adopting digital technology.
Absolutely.
And you will see dentists in tier 1 cities who are thinking twice.
Who are thinking twice and thrice.
Yes.
This question came from a background where if we see the total installations of scanO Air and ecosystem across India, it's a weird trend. I mean, I'm not able to figure out because few people in tier 3 cities with hardly 60-70,000 of overall population are investing and are able to see a revenue growth of 40-50% because of their mindset. They know the exact value propositions and use cases versus a few doctors in tier 1 cities, even some of them being in hi-fi localities.
Absolutely.
Thinking twice or thrice about how can I really make the use or unlock the entire ecosystem. Of course, we do have a complete training program and hand-holding engagement program where we help all the doctors unlock the potential, because say technology like scanO Air and many players I think are entering, and there should be, because the more we talk about it,
The
the
more you
more
will get.
we get, and the more normal it will become. At this stage, it is like a flying car. You buy it, but then you do not know how to unlock it. And that's where the programs like the engagement program that we have within the company and a few partners of ours are also leading that together
Good.
with us, right? So some of them have really got very creative. One of the persons had kept scanO attached it to the mobile dental van. So the way he is doing is in remote areas. First, a customer would come, a patient would come and scan onto the air, which is outside the mobile dental van. And then once, according to the triaging and the urgent and the emergent cases, they would first treat them, and the others can wait. So that's very good. Second person has just stationed it in a school, 365 days in a school, where they are making every student scan regularly, and a complete detailed report of the analytics goes to their parents or guardians,
Very good.
right? So that we can inculcate good habits right from the beginning. Third of our doctors, he has just placed it in corporates. We know how enthusiastic and energetic IT crowd is
Yes.
to try on new technology, and sky is the limit. So I think when we speak about all these use cases and help our community unlock the uses of technology, at which AI is one of the things, uh, again we can be better, bigger, bolder, and make changes faster, right?
Yes.
Yeah. Doctor, you have been one of those very rare dental surgeons who has a successful YouTube channel and have been covering content of all the spectrum. It has a wide spectrum, as we spoke. How was that journey? Tell me, how did you start Kaizen Dental YouTube channel? What was the thought process behind it? And what do you see the next steps or the future of it?
Uh, See, we started Kaizen Dental at a point where we were not sure what we wanted to do. Okay, practice was going well. We wanted to do something on the sides as well. So we realized that there are a lot of things which need to be taught in dentistry, in dental colleges and outside, but are not being spoken about. Okay, it's basically how to build a career in dentistry. So me and my wife, we are first generation dentists. Okay, so these struggles we face, the problems we face, no one discusses it. So you do not know what is the right option. Should you do MDS or not? Should you go abroad or not? If you want to go abroad, what are the ways you need to go abroad? If you want to get into a non-clinical field, how do you make that shift? Should you make that shift? Is it worth it? If you want to put a practice, how do you put a successful practice? All these things are not spoken. So like for example, we usually discuss dentists who are already successful, okay? And we discuss people who want to quit dentistry. That's it. There's nothing in between for first timers. So we wanted to create content which would talk about things which are not usually spoken. So we created a platform where just we create content related to it. So there was no goal as such. So when we were speaking just prior to this, there's no monetization from it. I'm not making any money from it. It's basically peanuts. Okay. The aim was just to spread awareness about problems which we couldn't discuss openly. That was the initial aim of Kaizen. So our tagline is helping dentists succeed. It was purely in that sense it was started. Okay. So now we have moved to a community of around 50,000 subscribers on YouTube and around 19,000 on Instagram. So now the plan is to try and unlock other things which dentists want but are not solved outside. We have not decided on what things these are, to be honest. Okay, it's a very broad spectrum of things. We are looking at people who would want to join us in this journey. We are planning to build a community related to it, and people who would be keen on supporting us with this journey. So we are open to all ideas, but there's nothing specific we have targeted as of now. So basically, we are looking at a broad spectrum of ideas, but we have not finalized anything specific as of now.
But are you looking at creating some niche out of the wide spectrum that you have? And are you thinking of launching a product? Is there any surprise element that you want to give to our audience here?
Nothing. As of now, nothing. Hoping to, but nothing finalized yet.
Got it. And so I think once you finalize how you want to navigate the further roadmap for your channel and the community that you've built and nurturing so beautifully, we will have some clue about the near futures of what is planned at Kaizen, right?
Hopefully.
Do keep us updated on that.
100%.
And for our audience, if you have any questions with respect to how to start a career, we already spoke about the dental launch pad, about AI, about how can you help unlock all the potential things for the community which is been built. Feel free to ask it in the comments below, and we would be more than happy to address that for you. Doctor, you are a first generation dentist. We have a lot of first generation doctors and dentists out there who are in doubt if they can be successful one if they don't have a background. What is your take on that?
I'll tell you what, I feel I'm not the most intelligent person out there. Honest. I am the most consistent or hardworking. So I feel if you're willing to put in the hard work, do things you don't know, willing to learn and go with the flow, then anyone can be successful. But yes, second generation dentists would have someone who is always holding their back, training them, guiding them of sorts, which a first generation dentist won't have. So you will have to rely on yourself and on people around you. I just heard this quote, okay, recently, is a bird when he takes off or sits on a branch. It's not that the branch they trust. They know that if the branch falls, they would trust their wings. So it's same for the first generation dentist. You should not be confident that dentistry will take care of you. You should work hard enough and smart enough to know that even in your bad days in dentistry, you would be able to take care of yourself. So if you're able to do that, there is enough scope in dentistry. There is enough money to be made in dentistry. India is a place where people were not spending money on doing fillings. People are spending money on aligners today. Okay, so there is a shift from people going to a grocery and making their payments after say a month, and there are people who are ordering stuff and getting it in 10 days. So India is a growing economy, and people are willing to spend on their smile. It's a generation which is born on Instagram. It's a generation which does work from home. So their smile, how they look, everything matters. So people are spending. So don't be afraid if there is potential in the market. There is. You have to only consider whether you have the potential. And I think if anyone else can do it, you surely can do it. So I think there is no dearth of potential for first generation dentists. They can easily achieve it.
Right. I love the quote and how you related with the field of dentistry. I would like to add one more thing here. Sometimes being a second or third generation dentist can be counter effective as well.
Absolutely.
For example, we have a few potential clients where the second or third generation doctor, he wants to inculcate a few technologies in the clinic, but then they are not able to make the decision because of the grandfather or father who are still the old school generation, right?
Yes.
And they're kind of holding them back. So I think if you try to see for all the good things, right, the benefits of being a first generation, and as doctor mentioned, you need to make sure that you are potential, you have enough potential of asking for what you're going to deliver. Nothing can stop you.
Absolutely.
Right? Yeah. And one advice or one take that you would like to give to our audience here, what would that be?
Know yourself, as in know what your strengths are, know your weaknesses. And if you feel you have to do something, even if it is your weakness, that is the thing which is going to take you to your next level. Be willing to do it. You have to have this growth mindset. If you feel that I do not know a particular thing and I will never going to learn it, you will never succeed. You have to be willing to push yourself. And I was just telling this off chat that people think I'm on camera always, so I'm an extrovert. I'm an introvert. I never felt I would enjoy talking in front of the camera, but I knew the message and the content I wanted to spread, this was the best medium. So I did things which I might have not thought, say, 5 years or 10 years ago I would do, because I wanted to push myself. So if you think you're stuck, the only way to get unstuck is to go through action, to push yourself and be out there. That's the only advice. So whatever path you take, you can easily be successful if you push yourself.
Perfect. Do not shy away from having the growth mindset, and please be consistent, work hard and work smart. Nothing can stop you otherwise.
Absolutely.
Thank you for a lovely chat. Thank you for sharing your insights, and we would be looking forward to your doubts or any questions that you might have, and stay tuned. Thank you.
Thank you.